With a spinal injury, this would be where someone has seriously injured their back. Let's just clarify the difference between a spinal injury and normal back pain. With normal back pain, this is where you hurt yourself with things like a strain, a sprain, soft tissue damage or slipped discs, which all cause pain and problems when moving. Where we're talking about spinal injury, this is where the spine is damaged or could be damaged, causing life-changing injuries and even death. Inside the bones of your back is your spinal cord. Once a spinal cord has been cut, it cannot be repaired. Common ways you can cause spinal injury are car accidents and falls from height, like a fall from a ladder. With spinal injury, the important thing here is we must not move the patient. If the patient has a fracture on their back and you move them, you can cause more harm than if you'd left them. They could have recovered with treatment and correct handling. In this scenario, someone has fallen from a ladder, so we definitely suspect spinal injury. Because we suspect spinal injury, we always treat as if it is spinal injury. You still introduce yourself, you still shout for help, and you just go around and support the head, which is holding their head in what's called the neutral position, just looking straight ahead. If you need to, you can move the head into the neutral position carefully to maintain their airway. Tell them to look ahead and try not to say or do anything that will cause them to turn their head round to look at you, because this could cause damage. If you approach someone in a car accident, you need to approach them from the front of the car and tell them to keep looking forward to stop them turning their head to look at you from the side of the car. The person here has fallen. You've approached and you're supporting their head to keep them from moving. Try not to cover their ears because you want to talk to them even if they're unconscious. Send somebody to call the emergency services and tell them you're dealing with someone who has a spinal injury. Keep the patient warm and immobilized the best you can until the EMS arrive. If the patient starts to vomit, turn them carefully into the recovery position, keeping the spine in line.